Hey, Robby, what's on your radar?
Well, I said this was coming, and now here we are. Federal health officials and the Biden White House are asking Americans to once again mask up to slow the spread of the highly contagious Delta strain of COVID-19. But here's the catch. The government is making this ask of vaccinated people. Not because the Delta variant poses a grave threat to their health, spoilers, it doesn't, but because in theory we could spread the disease to an unvaccinated person. In a press conference on Wednesday, CDC Director Rochelle Walensky explained that the vaccines still hold up remarkably well against the Delta variant in terms of preventing severe disease and death. They also substantially reduce infection rates and transmissibility. But what the CDC has found is that when rare breakthrough infections do occur, Delta's viral load is high enough that a vaccinated person could potentially transmit the virus. Probably not to another vaccinated person, who is extremely protected against severe disease and death in any case, but to an unvaccinated person.
This new guidance weighs heavily on me, and I just wanted to convey that this was not a decision that was taken lightly. Public health experts, scientific experts, medical experts, when I've shown them these data, have universally said that this required action. I saw it and I felt it when I saw the data myself. So I just wanted to perhaps close and say that this was not something that we took lightly and something that I know weighs heavily with me and with all of America.
So given that, the CDC wants vaccinated Americans to mask up while indoors if they live in areas of the country seeing significant spread. Just to be extremely clear, it's not for their own health. It's for the health of the unvaccinated. So doesn't that raise a pretty fundamental question? After all, the vaccines are widely available, with the exception of young children who aren't very susceptible to COVID anyway. Pretty much everyone who wants a vaccine, well, you can get one. I got one. If you can get the vaccine, but you don't want to, well, that's your choice. It's not a choice I agree with, but it's yours to make. But why should vaccinated Americans have to accept any further restrictions on our own liberties in order to protect the percentage of the population that isn't interested in protecting themselves? How on earth is that fair? Indeed, younger people who don't have much to fear from COVID were encouraged to get the vaccine because it would allow them to return to their life per usual. No more masks, no more lockdowns, no more social distancing. Millions of Americans have upheld their end of that bargain, but now the government is saying, well, it's not enough. Wear the mask anyway, even though it doesn't make any difference for your own health or the health of your vaccinated friends, neighbors, and family. Really, the CDC is undermining confidence in the vaccines by suggesting they're just one COVID mitigation tool among many, with masks being another. Consider this remarkably confused statement from Vice President Kamala Harris.
The only way we're going to cut this thing off. Nobody likes wearing a mask. Get vaccinated.
Nobody likes wearing a mask. Get vaccinated. That's what she said. But even if you get vaccinated, you might still be told to wear a mask if you live in an area of the country where COVID cases are rising? What? Note that this includes 2/3 of the counties in the U.S., mostly in the South, where vaccination rates have lagged, and we are again seeing COVID infection rates go up. What we haven't seen yet is a significant uptick in the death count. Now, in previous COVID cycles, it is true that deaths have lagged cases. So yes, it's always possible we'll really see the fatality numbers start to increase down the road. But keep in mind that the most at-risk population, seniors, have very high vaccination rates, and thus it's plausible that an increase in cases won't overwhelm our hospitals this time. Given that, local authorities are probably overly worried about case numbers. I mean, consider the District of Columbia. The White House is now instructing visitors to wear masks because of substantial COVID spread in the city. The city's coronavirus website, however, says we're experiencing only moderate spread, not substantial spread. Moderate and substantial are both abstractions, so let's add some numbers in. While the 7-day positivity rate has indeed increased since June 1st, there have been fewer than a dozen coronavirus deaths in the entire city during that time. It hardly seems like the situation is so dire that vaccinated people need to start masking up indoors or even in their own homes. Yet that is precisely what the CDC's new guidance requires. Walensky recommended that vaccinated Americans mask up while in close proximity to the unvaccinated, the immunocompromised, and children. Recall that even during the darkest days of the pandemic, no one in government suggested that families should wear masks inside their own homes. But after a year in charge of running our lives, federal health bureaucrats have become addicted to bossing everybody around. And now there's no level of acceptable risk for them. That also means that when school resumes in the fall, every student, teacher, and staff member will be expected to wear a mask, whether vaccinated or not, even though kids have as much natural immunity to COVID-19 as vaccinated adults. Just 300 Americans under the age 18 have perished from COVID during the pandemic. Remember the conservative talking point that coronavirus is just like the flu? Well, that's not remotely true in general, but it is true for kids and teenagers. The flu is actually slightly more deadly for the young. They don't need masks, and neither do their vaccinated teachers. But the CDC couldn't care less. Day after day, government bureaucrats and politicians prove that they aren't really serious about ending the pandemic. When asked about mandating vaccination for federal workers, President Biden said only that, well, this was under consideration.
Will you require all federal employees to get vaccinated?
That's under consideration right now, but if you're not vaccinated, you're not nearly as smart as I thought you were.
Are you concerned that the CDC's new mask guidance could sow confusion?
We have a pandemic because of the unvaccinated, and they're sowing enormous confusion. And the more we learn about this virus and the Delta variation, the more we have to be worried and concerned. And then only one thing we know for sure, if those other 100 million people got vaccinated, we'd be in a very different world.
The government won't force its own employees to get vaccinated, but it will force you to wear a mask, regardless of whether you get the shot. Does that sound fair? I don't know. Maybe I'm obsessed with this, Kim, but I'm really annoyed by how eagerly our health authorities reach for mask mandates. It's like they love the idea of mask mandates when we have a more effective tool, vaccination, and they're in no rush. They're encouraging vaccination, but the vaccines aren't even, they're under emergency authorization. They're not fully authorized. The CDC, the FDA, they're taking their sweet time, but they're like, yeah, everybody should just wear masks again. I mean, it's crazy to me.
Well, I think you're right in that I don't think this is ever going to end. I think that these mandates, and I actually worry that harsher mandates are going to be coming back in the fall. I think what's happening is that these politicians are looking at the data coming out of Israel. And Israel is a great test case country because they vaccinated nearly all of their adults and they all got the same one vaccine. And the latest data that just came out of Israel, I believe even yesterday or the day before, was that the vaccines are only, now they're saying 16% effective in stopping the spread, a lot higher effectiveness in stopping severe illness, a lot higher effectiveness in stopping death. But they're saying that for the people that were vaccinated back in January, their data is showing a 16% effectiveness. Now, the people that were vaccinated in April, they're showing a 75% effectiveness. So it does seem to wane at this point, but the data is still unclear. Nonetheless, so the fear is that we did vaccinate a lot of our elderly early on. And so they're thinking, oh, no. I think they're juggling because they're wanting to send the message of everybody needs to be vaccinated. But then, then it is a very confusing message to say, but then now you have to wear a mask. And they're not really willing to say it's because the data coming out of these other countries that are heavily vaccinated are still showing high levels of spread, Seychelles, Israel, Chile. And now there's even a preprint that came out, and this is why I think it'll really never end, is there was a preprint that was published yesterday that came out from Chile, and their studies showing that the Lambda variant, now you haven't even heard of the Lambda variant, right? So it's like we had the Delta, we've had the Alpha, the Beta, and now we're in the Delta, and then we're going to be moving on to the Lambda, and they're saying the Lambda might be able to evade vaccines altogether. So I worry that this really is never going to end, that we are going to be masked forever, and that we're going to go back into lockdown after lockdown after lockdown, and they're looking for a boogeyman to blame. And the reality is, you're right, Robby, in that you should be worried about protecting yourself, right? So if that's through vaccination or whatever you feel like is your best protection, whether it is just wear a mask or stay inside your house, some people feel much more comfortable that way. I'm all for whatever makes you comfortable.
Absolutely.
And whatever makes you feel safe. Do you, you do you.
Right.
But I do fear that we're going to be doing this circus for a long time until they realize and every expert has said they don't think this is going anywhere. We're going to have to learn to live with it, various strains coming around. And so I don't know. You know?
And we're also going to be spooked about how bad it is for forever because of the media's absolute addiction to what I call COVID panic porn. I was watching cable news again yesterday, and you can the glee, they're salivating at the idea that cases are rising again. They really are, because viewers, readers, et cetera, are way down with the pandemic waning in the post-Trump years. Trump was really good for ratings. They don't have him anymore. They need something to scare people. So all the, the trackers, cases up 7%, up 7% from like 14 to 18, and still no deaths. But so they're always going to be in terrify people mode, and begging for some kind of government intervention. And we're going to continue to get it unless we absolutely refuse.
Yeah. And, the one thing that really alarms me the most is that, look, if we are getting this data, we all say trust the science, trust the science. If we are getting the data coming from these other countries that the vaccine wanes after in effectiveness, and the people that are the most affected are the elderly. If it is waning, then they really do need to start talking about maybe giving a third dose to the elderly. And I don't know why they're not. I mean, to me, I'm like, why are they pushing? And they're trying to blame conservative America for not getting vaccinated, when actually Black America is one of the most hesitant groups to be vaccinated. They don't want to, they're pushing this, but at the same time, what they really need to be doing is saying, we got to protect grandma. I'm worried for my grandmothers. They're both 94 years old. So I want them to, they got vaccinated in January. I want them to have a third dose, a booster dose, if this data coming out of Israel is accurate. Yeah. I don't want them to push and demonize the younger person, the 22-year-old in Alabama who doesn't want to get it.
Yeah, it feels like health authorities will recommend wearing 3 masks before they allow you to get 3 vaccine shots. Coming up, panelists Max Alvarez and Henry Rogers, our team rising, when we return.